Hello, Ergo-Flex family. Dr. Robbie Wyatt. I've got several questions on the knee on track coming at me today, and I want to clarify some very important things. Number one, poundage, how much you should actually pull the patient, what protocols to use, and how long. I just recently had a couple of docs have great success with a patient. The patient got off the knee on track and everything was great. And then the next day they called him saying, oh my gosh, I've had the worst knee pain of my life. I can't walk, and so on and so forth. And this doctor had taken about a 120-pound lady, very petite lady, used protocol 2 for 10 minutes at 20 pounds, which is swinging for the fences, okay? That is a big, big, big pull, and will create. She got off the knee on track feeling fantastic, but we are pulling so much tissue and moving so much, breaking up scar tissue, that boy, patients can get really, really sore when that happens. So I want you to be really, really, really gentle. We're only trying to move that joint anywhere from 2 to 5 millimeters, okay? You really start moving it more than that, you're breaking up tissue, scar tissue at a very fast pace, which means you're gonna have quite a bit of a flare over the next 2 to 3 days. So the other thing is the illustrated protocol list for the knee on track. If you don't have this, please let us know. We'll get this to you. This basically shows you what each protocol does, okay? Illustrates it. I know the manual is very confusing, so that's why I went through and did the illustrated. Okay, so very, very important that you get this. Let us know if you don't have it. So let's get down to brass tacks. Anybody under 175 pounds, okay, that is not a high impact athlete, okay? That means volleyball player pounding on concrete, basketball on a regular basis, running 3 to 5 miles every 4 days or every 2 or 3 days. You know, somebody who is hitting the gym and working hard, those guys, CrossFit, just really hammering 4 and 5 days a week, those would be considered a high impact athlete, okay? And a lot of those guys are 175 pounds or less, and ladies as well. This does not apply to those individuals. This is your everyday, I'm not pounding the pavement, somebody that weighs less than 175 pounds. You want to start them typically at the 12 to 13 pound mark, all right? And we are going to work on them for 6 minutes, 360 seconds on the dial. So 360 seconds, protocol 3, all right? Protocol 3 takes you out to the poundage you set. Let's say you set 13 pounds. It takes you out to 13 pounds. It holds that for 1 minute. Then it backs off to 50%. So 13 pounds is going to take it down to 6.5 pounds. And it's going to hold that for 30 seconds. Then it's going to go back up to the 13 pounds, 60 seconds, 6.5 for 30 seconds. So it's going to cycle that way through the entire 360 seconds or 6 minutes, okay? If you don't have a knee problem, say you're a staff member, I was just talking to Sharina, and you don't have a knee problem, you get on the knee on track, it's going to feel like it's doing nothing, okay? And then you crank up the poundage and you start to have slippage, all right? Rarely, again, very, very rarely did I use anything over 20 pounds. I'm talking about patients that were in the 350 to 400 pound class, okay, and were severely degenerated. And the reason why I was using 22, 24, 25 pounds with that person is because I had a lot of tissue slack I had to get through, okay? So we had very meaty legs. We're trying to move a lot of tissue so that we can get the joint to move, all right? So, and ultimately, you really need to be skin on skin, all right? You can do it over the pants and just bring it up, but do yourself a favor, go out to your local sports shop, academy, whatever it may be, pick up a bunch of different sizes of this spandex sports shorts, nice, like a basketball short, and just have those in so that patients don't come in prepared right. You can just throw them, they can go in the bathroom, put those on, now you're skin on skin, because that's going to be your best entrapment of issues, okay? So again, we don't want to go much more than 6 minutes, okay? The top end of 20 pounds, protocol 3 is excellent. Look at the protocol list for other other ideas. Now, let's talk about your 176 and up class. Those typically, I will start them at 15 pounds, okay? 15 pounds, protocol 3 for 6 minutes. It's very simple. It's going to be whatever poundage, protocol 3, 6 minutes per knee. That's the simplest, fastest way to do it. The other protocols, like if you do protocol 1, if you're doing injections, you have no joint space. You can do the static traction, open up that joint space and get that needle right in there. Shouldn't be any problem. But other than that, very rarely you're going to use something besides protocol 3. If you do and you start finding great results, please let me know. I did protocol 3 for 3 years. Basically what I did. Now, there needs to be a progression in your treatment plan. So in other words, you need to increase poundage clinically appropriate. Very important. It needs to be clinically appropriate. Okay. And typically what you'll find is the patient will go, hey doc, I just don't feel the knee on track like I used to. That's a clear indicator that you need to increase poundage. Okay. Now, how do you do that? You need to do it very carefully. All right. My protocol was that every 3 visits, I reevaluated whether we needed to increase poundage. I increased it by 1 pound. Okay. So every 3 visits, I would reevaluate whether or not there needs to be a poundage increase. If there was, I would increase it 1 pound on the 4th visit. Okay. And then the next 3 visits, I would reevaluate and increase it appropriately, clinically appropriate. So for somebody I started at 12 pounds, they may end up at 17, 18 pounds by the time a 24 visit protocol is created. I kept the ceiling of that protocol at 20 pounds. Okay. So if somebody is starting at 15 or 16 pounds, they're going to increase up slower. And then I just left them at 20 pounds. We just, for the remainder of their treatment plan. Okay. Again, very rarely did I go above 20 pounds. So those are some of the key factors for the knee on track. If you have any questions, any specifics that you want to know about as far as training, what kind of videos you would like, please let me know at dr.wyatt@backontrack.com, or you can certainly call me here at Ergo-Flex and let me know exactly what you're needing, what your concerns are, and how I can best help you get your patients on and get them going right. Okay? All righty. Y'all have a great one.